In this short video, today we will discuss UTI. What's UTI stands for? UTI mean urinary tract infection. How we can define UTI? UTI mean the infection in any part of urinary system. So now, what is urinary system? Urinary system in the body is composed of kidneys, ureters, urinary bladder, and urethra, which is responsible for removing the waste products from body in the form of urine. The urinary tract further divided into two parts: the upper urinary tract and lower urinary tract. Upper urinary tract composed of kidneys and ureters. Lower urinary tract is composed of urinary bladder and urethra. Like urinary tract division, the infections in urinary tract also divided into two. The one is upper urinary tract infection and the second one is lower urinary tract infection. If we have infection in upper and kidneys and ureters, it will called upper urinary tract infection, and if the infection is in a urinary bladder or urethra, it will called lower urinary tract infection. If the patient comes with UTI, he or she will complains with fever, having on off fever with chills. The second complaints, which is very common, is burning micturition. Burning micturition mean acidic urination or burning sensation during urination. The third sign will be urgent urination, but here it is the point to remember that the patient will need or feel urgent urination, but in very little amount of urine will comes out. Due to these conditions, the patient will complain with stress, depression, and anxiety. After seeing these all complaints, we will go for investigations to confirm the UTI. In UTI investigations, we will advise CBC. In CBC, if there is UTI, WBCs will be increased because this is bacterial infection. The second investigation is urine routine examination. We will see the pus cells, the number of pus cells and RBCs in urinary. For further investigations, we will advise the patient for ultrasound and X-ray. X-ray and ultrasound of kidney, urinary bladder and ureters. After confirmation of UTI, now we will treat the patient. If the patient is adult mean if the patient age is more than 18 years, we will advise the patient treatment in tablet form. For infection, we will prescribe antibiotics like levofloxacin 500 mg in BD and cephaloxacin 500 mg in BD. BD mean twice a day. With UTI, the patient also complains having complaint of pain, so we will prescribe also painkillers, NSAIDs, for example Brufen, Ponstan and TDS. Also in complaints, the patient is complaining of burning micturition. For avoiding that burning micturition, we will prescribe the alkalinity agents like sodium citrate, which is present in sachet form, like cetrosoda, and syrup cetralca or fedralca in water, which also responsible for alkalination of urine. So this is all about the UTI in adults.